Hi, my name's Bruce Robinson. I'm a physician who specialises in lung diseases, and I'm also a researcher who studies immunology. I'm going to tell you now about an exciting new digital health project that could help you and those you care about avoid serious COVID-19 disease. A team at our university hospital has created a digital program called EDICT to communicate regularly with you, to provide COVID information via smartphone or tablet or computer in your language. It's all free and it's all secure. If you sign up with us, you'll receive regular information on a variety of COVID-related topics. Some of the topics that we will present include the coronavirus and the new variants, including any future Omicron-like variant that's discovered that might frighten you. And you'll be able to get that important information immediately that it becomes available. We'll also talk about how the virus affects the body, especially the sorts of diseases like pneumonia that scare people because of the need for oxygen and sometimes intensive care therapy and, sadly, death. We'll also talk about vaccines. Which is the best vaccine? How many shots should I have? When should I get them? And what are the side effects? Now, very importantly, we're going to talk about vaccine hesitancy and especially the myths around COVID vaccines that have circulated wildly on social media and made people quite hesitant sometimes about taking the vaccine. We're also going to talk about COVID and the aged. You know that most deaths occur in people over the age of 60 and it increases with increasing age. And we'll talk about how to protect the elderly people in our families and communities, people that we love. Now, importantly, we're going to also talk about these brilliant new drugs that slow the disease down and prevent infected individuals from requiring hospitalization and going on to intensive care. They're not vaccines, so they should work even if the virus escapes immunity. So we'll talk about how they work, who's going to get them, will they be free. We're also going to talk about isolation, how best to stay safe in isolation and how to cope with it and make it a fun time instead of a miserable time. This is especially helpful for families when the kids are required to be at home rather than at school, and of course when parents are working from home. We've also got videos on digital monitoring of health, and this is really useful for those who are at risk of severe disease, such as those with a pre-existing illness or who are over 65 years of age. We'll explain how this remote monitoring of your health occurs. It's exciting new technology and how it can help you and how it all works. We're also going to talk about mental health, such an important challenge, and it's been described as the second pandemic. Those feelings of depression, anxiety, fear, anger, and other emotions caused by lockdown, isolation, and the economic and social challenges that flow from that. We are working with some of the university's top people to provide information that's helpful about mental health, and this will include some mental health being assessment surveys for you to fill in if you're interested. We will regularly send you videos and perhaps other formats on all of these topics and more, containing the latest, clearest and most helpful authoritative information, which will include clips from the best talks on these subjects from other experts. So look, if you would like to receive this information from us regularly, you do need to contact us in order for us to be able to send you this information directly. Remember, it's all entirely free. It's all secure. Your emails will not be passed on to anybody else. Your mobile numbers will not be passed on to anybody else. Remember, when you send us your email address and mobile number, please send us your name and your preferred language. The information, as I said, will be stored at the university and will remain safe and secure and will never be passed on to anyone else. We plan to create a system whereby you can also send questions. We can't guarantee to answer them all immediately, but we will include in our program some question and answer videos in which we will reply to most of the main questions that we receive. So our goal is to keep you safe by creating this spider's web of digital communication. And finally, speaking as a doctor who treats patients with lung diseases, and on behalf of the whole team and the hospital staff really, we do share those feelings of deep sadness when patients get sick and die of COVID, or when individuals get mentally stressed when they're stuck at home. A big problem. And we really are doing this out of compassion to help everyone. And we think this digital connection is the way to do that. In fact, our research shows that that is correct. So please send us your information and also pass this invitation on to your family and friends so that they too can get connected with us. Please do this for yourself and your own family and community. And if not for yourself, especially for the elderly people whom you know and love who are most at risk. Why not do it now? Right now. We look forward to hearing from you, and again I'll leave on the screen those email addresses and phone numbers for you to make contact. Thanks very much.